When you have a gastrointestinal problem, get the experienced top quality care you deserve without having to leave town at SWGI Specialists.
Hi, I'm Dr. Fraser Stokes. I'm a board-certified gastroenterologist at SWGI Specialists. I've been practicing here for almost 21 years now, and my wife Sharon is a local dentist in the community, and I have two children in the Uniontown area. One is my daughter Olivia, who's a junior in high school, and the other is my son Robert, who is a junior in college at George Washington University. SWGI Specialists was founded in Uniontown in 1990 by Dr. Fred Ruthart. 1 year later, Dr. Chuck Calabrese joined the group, and 2 years after that, in 1993, I joined the group. In 1996, Dr. Raji Balu joined our group, and then in 2009, Dr. Mark Hoppy joined SWGI Specialists. So we have 5 physicians here. We also have 6 physician assistants at SWGI, and we also have an endoscopy center where a video tour is going to be done as part of this program to highlight some of the offerings that we have there. Total number of employees that we have both in the practice at SWGI and the Southwestern Endoscopy Center is over 50. We have a website where great information can be had about our practice and about GI conditions and their treatment, which is swgispecialist.com. We actually have a new smartphone app. If you go to your app store and look up SWGI, you'll find our smartphone app, which has all kinds of helpful hints about the practice, as well as for preparing for an upper endoscopy and a colonoscopy.
What is a gastroenterologist?
A gastroenterologist is a physician that specializes in digestive problems. It's a physician who's gone to college for 4 years, medical school for 4 years, did a 3-year residency in internal medicine, and then did 2 or 3 additional years of training specifically geared towards learning about diseases of the digestive tract and how to diagnose them and treat them.
What problems do you help people with at SWGI?
We help people with problems throughout the entire digestive tract. So the way I like to think about it is you start at the mouth and you swallow your food, and the food goes through the esophagus, and there are multiple problems there, including acid reflux and troubles with swallowing. And then the food gets to the stomach, and the primary problems in the stomach are stomach ulcers, gastritis, and stomach cancer. And then the food goes through the small intestine, and the primary problem there is problems with poor absorption of food, which can lead to chronic diarrhea. A common issue there is celiac sprue, which is a gluten problem. The food is processed by way of enzymes and chemicals that are made from the liver and stored in the gallbladder. So we take care of issues of the liver like alcoholic liver disease, fatty liver disease, hepatitis C, liver cirrhosis, and liver cancer. We also take care of problems with the gallbladder involving gallbladder stones, gallbladder dysfunction, which is a common cause of chronic upper abdominal pain. We take care of problems with the pancreas, such as chronic pancreatitis and acute pancreatitis. And then we also take care of problems of the colon and the rectum, primarily problems involving irritable bowel syndrome, which is a chronic abdominal pain syndrome, problems with patients' bowel habits, such as chronic constipation, chronic diarrhea, problems with inflammation of the colon and small intestine, such as Crohn's disease and ulcerative colitis. And then lastly, problems primarily involving the rectal area, such as hemorrhoids, and such as anal fissures, which can lead to chronic rectal bleeding, as well as problems with the sphincter muscle in the rectum, and when it's not functioning, leading to problems with people not being able to control their bowels.
For whom do you recommend colon cancer screening?
We recommend at SWGI specialists the standard guidelines that the American Cancer Society recommends, as well as the American College of Gastroenterology, which is that everyone beginning at age 50 should have a colonoscopy every 10 years. Now, if you have a family history of colon cancer or a family history of colon polyps, you're likely to want to get screened earlier than age 50. And in addition, if you're African American, we advocate getting screened beginning at age 45 because colon cancer is, believe it or not, a bigger problem in the African American community, and those are the standard guidelines there. Colon cancer is a big problem in America. About 140 to 150,000 new cases of colon cancer are found every year, and roughly 50,000 people in America die with colon cancer each year, making it the second most common cancer killer in America, with the number one being lung and number two being colon as far as the number of deaths attributed to a particular type of cancer. So it's a pretty serious problem, and we're very big on colon cancer awareness, advocacy for screening, because screening really can make a difference. Colon cancer starts from little tiny polyps that over about a 7 to 10 year period grow into bigger polyps. Polyps are little growths that have precancerous cells in them. And then over that long process where the polyps get bigger and bigger, eventually that polyp can degenerate into a cancer. So the beauty of doing a screening colonoscopy is with the polyps not causing any symptoms, the polyps don't bleed, they don't cause anemia, they don't cause pain, we get people who are feeling great, we get a colonoscopy done. If they have polyps, and roughly about 20 to 40% of people that we do colonoscopies on actually have polyps, we remove the polyps. Thus, in that spot where there's precancerous cells, we take all that stuff out with a simple colonoscopy that takes about 20 minutes, and the only thing that's left there is a little small scar. So that is the beauty of the test. It prevents the cancer from forming. Yes, we're kind of, with the screening, looking for early cancers, but very rarely will we actually find a cancer in a routine screening colonoscopy. What we're primarily looking for is finding polyps and getting them out and preventing cancer from forming. And since we've been doing this screening for cancer prevention, roughly now with colonoscopies for 15 to 20 years, there's been a definite decrease in the number of cancers found and the deaths from colon cancer in the United States.
Is there effective treatment for hepatitis C?
I'm glad you asked that. About 4 million people in the United States now have hepatitis C, and it's a virus that gets into their bloodstream and then infects their liver, and it sits there dormantly for many, many years. It causes chronic inflammation of the liver, which can eventually lead to chronic scarring of the liver, cirrhosis, as well as can lead to liver cancer. We identified hepatitis C in 1990, and shortly thereafter we started with treatment for hepatitis C. And over the process of the last 24 years, there's been slow progress in effective treatment for hep C, so that now the FDA just approved a new drug about 3 months ago called sofosbuvir, which in combination with other traditional hepatitis C treatments allows for cure of hepatitis C in 80 to 90% of patients, and most of them only need to be treated with 3 months of therapy. So there's been great strides in treatment. It's easier to take, there's less side effects, and we're expecting over the next 2 to 3 years there's going to be even greater progress made. So the medicines are all approved by the insurance companies, and we're expecting with this new breakthrough drug to see more and more people come into our office to be able to get cured for their hepatitis C, so they don't have to go on and develop cirrhosis, liver cancer, or the other problems associated with hepatitis C.
Is there any way to help people suffering with bowel control issues?
Yes, there is. Bowel control issues are a very important topic, but people unfortunately do not want to talk about it. People that have accidents, people that have fecal soiling, people that lose control of their bowels, this is a very common issue. About 2% of the general population actually suffers with this problem, but people that have it are very embarrassed with it. They don't want to talk about it. They're depressed about it. They're anxious about it, and it can completely take over their life and alter the way that they run their life. So they're always alert to where bathrooms are. Frequently, they will be walking around in diapers. They're alert to different smells that are arising, and so it changes their social interactions. It changes their ability to shop, to go to church, to go to restaurants, etc. So it's a big problem. Now, there's a new treatment that's available for this issue, and it's called InterStim. And basically what it is, and we have it offered through our office and have had so for about 9 months now, it is an electrical stimulator whereby a electrode wire is placed in the S3, that's the sacral nerve root foramen, which is a small little hole in the bone structure in our back. And very easily, in about a 20-minute procedure, we can feed a little tiny wire right into the area where the S3 nerve is, and attached to that wire is a very light electrical stimulator. And by gently and lightly stimulating that nerve, we can help people get better control of their bowels by increasing the tone of the sphincter muscle down in their rectum. We've had 2 patients that were so happy with their results with this treatment that they actually broke down and cried in front of our office staff. So it can be very dramatic. The treatment works in over 50% of the people that have it. It's approved by essentially all of the insurance companies. And so we're trying to encourage people in the community and patients that come to our office to talk about the condition. There are occasionally some medicines that can help, but definitive treatment is available, and we really want to try to help people. It can definitely be a life changer.
I understand that you have a new weight loss program at SWGI that really works.
We do have a new weight loss program at SWGI, and it's called Ideal Protein. And I'd like to just briefly talk about this. About 50% of Americans now are overweight. And this is a very big burden on the patients, and it's a big burden on the healthcare system. And what's happening is that as people are getting more and more overweight, they're developing issues like diabetes, high blood pressure, high cholesterol, heart disease, sleep apnea. Sometimes they'll have strokes. They get acid reflux disease, and a condition that we frequently treat is fatty liver, which can lead to chronic inflammation of the liver, where fat cells get deposited in the liver, and it can even lead to liver cirrhosis. So overweight conditions are a big issue around America. It's an even bigger issue in Fayette County. And so I went to a meeting of the American College of Gastroenterology this past fall, and they advocated trying to get patients in the practice and people in the community that suffer with problems with overweight on a specific diet program, which is called Ideal Protein. And we have instituted this at the beginning of January. We now have 17 patients on it, and we're only less than 2 months into the program. And it's impressive how people are losing weight and feeling better and getting their overall health wellness in order. And the program is set up such that people go on low carb, low fat, and an ideal, just the right amount of protein. And they come to our office. Initially, they come for a workshop where they get introduced to the program, and a brief presentation is made, and questions and answers are done, and patients are allowed to taste some of the food. And then the second thing is they come to our office for a consultation where we do a careful medical history, and we do body weight measurements where we measure their weight and their bone weight and their muscle weight and their percent body fat and their metabolism rate, etc. And then we set a target weight goal, and then they following that, they purchase food from us. And the food, again, low carb, low fat, ideal amount of protein. They come back to the office every week and they purchase food from us for breakfast, lunch, and a bed-night snack. For supper, they're supposed to eat food that they get from the grocery store, which we tell them specifically what to get, primarily vegetables and protein such as chicken, fish, pork, beef, etc. And then when they lose weight, and it's very predictable that they're going to lose weight, we have of our first 14 patients, 13 have lost a substantial amount of weight. And the one that didn't cheated on the program, and so we're encouraging him to be more compliant. But after they've lost the weight and they've gotten down to their ideal weight, then we taper them off of the food that they purchase from us, and we help them with healthy food choices, again to emphasize the low carb, low fat, ideal protein. And then we help them maintain that, so hopefully they can keep that weight off for life. And we're very excited about it. We think we can really help people in our community with weight loss.